You know, some of the most powerful medications we have can come with side effects that sound, well, pretty intimidating. So today we're going to tackle one of them head on so we can replace any fear you might have with actual facts. All right, let's dive into this.
We're talking about a class of drugs that have been absolute game changers. I mean, for cancer patients with bone metastases, medications like Xgeva can just dramatically reduce pain and stop fractures, which is huge for their quality of life. And for the millions of people with osteoporosis, drugs like Fosamax and Prolia are the frontline defense against really life-altering hip and spine fractures. They are, no question, medical marvels.
But you've probably heard the whispers, right? Or maybe you've seen a scary warning about a rare but serious side effect that involves the jaw. So what exactly is this risk, and who should really be concerned about it?
Okay, let's start by breaking down what these drugs are and what this side effect, which by the way has a very long name, actually is. And way more importantly, what it all means for you.
So the drugs we're talking about fall into two main groups, bisphosphonates and something called rank L inhibitors. Both of them are what we call anti-resorptive agents. Now think of your bones like a road that's constantly under construction. You've got one crew that demolishes the old, worn-out bone, and another crew that builds new bone. What these medications do is they basically tell that demolition crew to slow way down. This lets the bone get denser and stronger, which is fantastic for preventing fractures.
All right, now for that intimidating name. It's called MRONG. It sounds super complicated, I know, but the clinical definition is actually very specific, and we're going to break it down right now.
MRONJ. It stands for medication-related osteonecrosis of the jaw. And all it really means is that it's a rare condition where a little patch of jawbone becomes exposed through the gums and then just doesn't heal for a long time. The key word I want you to hear, though, is rare. And you're about to see just how rare in a minute.
So, to get an official diagnosis of MRONJ, a patient has to meet all three of these criteria. It's like a checklist. 1, you have to have taken one of these drugs. 2, the exposed bone has to stick around for more than 2 months. And 3, you can't have had any radiation therapy to your head and neck. This super specific definition is really important because it helps doctors rule out other, more common dental problems.
And this brings us to what I think is the most important question of this entire explainer. Who is actually at risk? Because the answer is definitely not everyone who takes these drugs. The context, the dose, and the whole reason you're taking the medication in the first place, it all matters immensely.
Okay, this is the crucial point. We really have two completely different groups of patients here. On one side, you've got cancer patients who are getting high-dose, frequent IV infusions to manage bone metastases. On the other side, you have osteoporosis patients. They're taking much lower doses, way less frequently, just to prevent fractures. And as you can see, their risk profiles are just worlds apart.
And this slide, wow, this slide really puts that difference into perspective. For cancer patients on that high-dose therapy, the risk of MRNJ is still pretty low, usually under 5%. But for the millions of people with osteoporosis, the risk is just minuscule. We're talking less than 0.05%. That works out to fewer than 5 in every 10,000 patients. That risk level is so incredibly low, it's almost impossible to tell the difference from people who aren't even taking the drug at all.
Now, besides the dosage, there are a few other things that can influence this risk. The number one trigger, by a long shot, is getting a tooth pulled. Having pre-existing dental infections, how long you've been on the drug, and using other meds like corticosteroids can also play a role. The clear takeaway here is that your oral health is directly, and I mean directly linked to your risk.
So, let's build on that. Let's move into a proactive plan, because knowing the risks is one thing, but knowing how to manage them, that's empowering. And the good news here is, MRRG is largely preventable.
The core message from every single major medical and dental association is this: prevention is everything. And prevention is a team sport. It involves you, your doctor who prescribes the medication, and your dentist who looks after your oral health.
So for patients who are about to start that high-dose cancer therapy, the ideal playbook is super clear. Before that first infusion, get a full dental checkup. Address any big issues like getting teeth pulled that are beyond saving. The whole goal is to get your mouth as healthy as humanly possible before you start the medication to give any surgical sites plenty of time to heal. Now, once you're on the therapy, the strategy changes just a little bit depending on your risk group. For everybody, excellent oral hygiene is absolutely non-negotiable. For the high-risk cancer patients, the goal is to try to avoid invasive procedures if you can. But, and this is a big but, for low-risk osteoporosis patients, elective dental surgery like extractions or even implants is generally considered safe. The key, as always, is communication.
So let's zoom out for a second and put all of this into perspective. It's really easy to focus on a scary-sounding side effect, but we have to weigh that against the very real and far more common problem these drugs were designed to prevent in the first place.
This quote from the American Association of Oral and Maxillofacial Surgeons just hits the nail on the head. The fear of MRONJ has become so widespread that a lot of patients, especially those with osteoporosis, are actually refusing treatment. They're avoiding a tangible, proven benefit to prevent a risk that, for them, is incredibly small. And this has created what experts are now calling an osteoporosis treatment gap.
And what's the consequence of that treatment gap? Well, this number. This is the percentage of people who ever get back to their pre-fracture mobility after breaking a hip. That means about half of elderly patients who break a hip will never, ever regain their former level of independence. This is the devastating reality that these medications are proven to prevent.
So, ultimately, it all comes down to this. When you weigh the proven benefit of preventing a completely life-altering fracture against the extremely low risk of this jaw condition, well, the choice for most people becomes very, very clear.
So after all of this information, what is the one thing, the single most important action you can take to protect yourself and put your mind at ease?
It is this simple. Communication. Make sure the doctor who prescribes your bone medication knows about your dental health. And make sure your dentist knows you're taking one of these medications. When your healthcare team is talking to each other, you are in the safest possible hands.